Hey Randy, what's going on in DC today?
Some pretty big news. The president signed an executive order which is pretty sweeping, and it involves mostly Medicare-related issues. And I think this is in the context of the presidential election in 2020, which is obviously heating up. But there's also some really interesting things that we found within the executive order that very well may impact CRNAs in the near future.
So what's AANA's involvement in these kind of matters?
Well, we've been very active for a long time, particularly in the last year and a half, 2 years in DC, working with CMS, HHS, and Congress to identify a path forward to opening up access to anesthesia care in this country. And I think this is a big piece of that, which is an executive order which essentially states that providers should be practicing at the top of their license, whether a physician or non-physician. And we think that makes sense. Also, around reimbursement. And we've had issues by commercial payers and even Medicare administrative contractors who are not paying CRNAs the reimbursement rates that they deserve and they've earned. And this certainly appears to be a vehicle by which we can address that, which is exciting.
So what's next?
So what's next is we need to spend a lot of time and energy in Washington, D.C. On this executive order as it's being implemented. The interesting thing about this is it's time-boxed. So the president has given the agency a year to address the elements within the executive order, which is exciting because I think that presents some energy and an opportunity for us to be very effective. So, I mean, from our perspective at the AANA, we're going to spend a lot of time, a lot more time in D.C. to make sure this thing is implemented in the way that it should be, and that our patients have access to anesthesia care, and that CRNAs are a big part of that answer.